Hello and welcome. My name is Natasha Bradley and I'm very excited to be joined by Debbie Harris from Autumna. So welcome, Debbie. Would you like to just give you a bit of an introduction to yourself and company?
Yeah, thanks, Natasha. My name is Debbie Harris. I'm the Managing Director of Autumna. We're an online directory with a 7-day-a-week advice line, supporting families who are looking for social care for their relatives. So that's care homes, home care, live-in care, or retirement developments.
Fabulous, thank you. Debbie, one of the main pressures for the NHS is bed blocking. I was reading an article a few nights ago from the Health Foundation, who states in this decade, more hospital capacity will almost be certainly required to meet people's health needs. So by adding more beds, do you think that will support the discharge process and speed things up, or do you think it will make it worse?
From a personal perspective and from the perspective of the families we speak to, I think the primary issue is not necessarily to have more beds, but to ensure that the people who are sitting in those beds leave hospital in an appropriate and timely manner. And that isn't happening at the moment. And I think if you simply added more beds, unless you address that first problem, you're simply just going to have more people sitting in more beds. I mean, I always think of it, it's a bit like having a cork in the NHS. You know, you've got this cork in the top of the NHS bottle and it's getting people out of the hospital beds. And unless you get them out of the bed, it affects all of the things we're reading about in the papers. So it affects the person sitting in A&E who can't be admitted to the hospital because there's no bed. It affects the person in the ambulance outside who can't get into A&E because there's no space. And it affects the person who is at home waiting for the ambulance, which doesn't arrive because it's sitting outside A&E. So that if you don't address that hospital bed, moving somebody on to an appropriate placement, if you don't address that, you're actually influencing and impacting 4 people. And that's without taking in the planned operations who also need who need a hospital bed.
So if we could support the flowing of patients through from entering hospital through to discharge, how could we do that? And how can you support that from your perspective?
Okay, so I think there are several reasons why it is difficult to get somebody out of hospital when they're medically fit to leave. Of course, that's the key criteria. You've got to be medically fit to leave. But if they're elderly, there are several things that slow down the process. I think the most important one, and the one that potentially takes the most time, is the time it takes to identify an appropriate placement, whether this is a care home or home care. So if you think about, you have a patient who is sitting in your hospital bed and you've recognized you've been given the sign off that they can leave today, I actually dread to think what the average length of time is for somebody to discharge if they start looking on the day that they could have been discharged. I actually dread to think, because we did some research on some of the patients we're supporting and the families we're supporting, and they're finding us online, and they've already been in hospital for an average of 31 days waiting to find care before they find us. 31 days. It's a month. I mean,
is that... Sorry, is question popped up there? Is 31 days counting when they should or they could have left if care was put in place? So, yeah. All right. So it's not even the charge. Yeah.
31 days. And so one of the things that we do, and we're working with quite a few hospitals, social workers, discharge teams, so we're supporting them, and patients, of course, and their families, is we have a very simple, and I'll call it an online assessment tool, because ultimately that's what it's doing, but it's basically just a type form where somebody can fill in their details and we prompt them. So if you're looking for a care home, we prompt them to think about things by asking questions. You know, what type of care home are you looking for? Because people don't think about these things when they're looking for care. So, you know, is it nursing? Is it residential? Do you need dementia care? You're not sure what they are, so we give them a little explanation. And we just take them through all the different things they need to think about. And then at the end of that, we've got an idea of what they're looking for. And we can then, because of our directory, our database, we can send out pre-filtered inquiries to all of those care providers. So if somebody is looking for residential dementia care and they've given us their budget and they've told us when they are looking for that care, so yesterday probably, and any other inquiries, you know, or any other points that they might make, or the location as well, we can send that out to every registered care provider who fits that criteria, and we can send it out in about 10 seconds. So it just speeds up the process, just identifying available care homes. It's just the identification. Yeah.
And I think, from my understanding, the way that most hospitals do their discharge is a manual process. You will have a nurse, or some sort of role rigging round each individual care home within that area with a list to say, we've got a patient with XYZ needs, can you meet that? So they're ringing round. Is that,
that is what happens, and it takes days. And you know, they'll wait days for care homes to call them back. We do this in 10 seconds, and it's all about that speed and accuracy as well. So it's a really accurate that's why I call it an assessment. It's not really an assessment, but it's just prompting the consumer or the social worker. These are the questions the provider needs you to answer in order to say whether or not, in theory, they would be able to accept this patient subject to assessment. You know,
and I've still got that in the back of my mind, Debbie. 31 days.
I know. It's horrifying.
You know,
and that's the average, Natasha, of the ones we assessed. That's the average.
Yeah, 31 days. So I think what you're saying is that you can really digitalize the manual process of being able to discharge a patient into the community care within sort of 10 seconds. So this 31-day average that we've been discussing, it could be mitigated. Obviously, there's a whole raft of things that we can do, but you know, it's just nice to hear, really. Whereabouts? Who's sort of using this? Whereabouts is this being put in place at the moment?
It's across the country. So we're being contacted by individual social workers working in teams, individual hospitals, and we are working with them. I'm actually doing demonstrations to some hospital discharge teams, so that because it's a really simple form to fill in, and then the information comes straight back to them or whoever they want it to go back to be honest. But it just overcomes that first hurdle, which is this is what the patient needs, this is the patient's budget, this is the patient's location and timescale. Which care home out there can support her?
Yeah,
you know, and that's what you need, and then you can start working on the detail. But at least you're only ringing 4 care homes or 6 care homes, not 46.
Yeah, and I think as well, before, you know, so that's moving the patient from hospital into the care home, but also where I've seen sort of, especially the Microsoft Teams technology used, is where the discharge team can have a virtual discharge within the hospital before they try and get the care package in place. Yeah. So I think it was the University College London Hospital NHS Foundation Trust. I think they did a sort of case study around teams, bringing members of the care teams together, and they found that by doing their internal discharge, you know, virtually sped up that process and limited patient time in the hospital. So I think between the technology, we can definitely, you know, speed up the discharge process, but also, as you mentioned, impact ambulance coming into hospitals, A&E, etc., all the way through, really, isn't it?
It is. It really is. And also, do bear in mind that this is something that operates 7 days a week. So what tends to happen in the hospitals is, unless somebody is discharged by Friday afternoon, they sit there all weekend, and then on Monday you've got 3 days worth of discharge to try and sort out, and you've got everybody's Monday clients trying to come in. There's no reason why this just can't keep on going every single day of the week, because you're not having to have somebody sit on the phone, ring all the care homes or the home care agencies. Just keeps going.
Yeah, I've been doing some work recently with some care homes in a particular area, and I know how busy and stretched they are. So actually getting them to answer the phone would be a challenge in itself.
Yeah.
Never mind trying to get them, to take that forward to get the patient, but just getting them to answer the phone's a challenge because of the staff shortages.
Yeah.
I think it's great.
Yeah, if you're working with the providers in the way that we do, then we can send this notification out. We could be working with a local hospital, and you can send out a notification. So it goes to a dedicated person who is just picking up the hospital discharge notifications and then just replies immediately. Yeah. So we can really tailor this so that it's not going to a busy manager or going to the care home when the manager's on holiday and nobody's picking up these notifications. It can be really targeted. It's digital. It works, doesn't it?
There's a big thing about the moment about digitalising social care, and I think especially what you've described, you call it an assessment, but I'm sure it's a lot more than that. But just that element to bridge the gap between social care and the hospital in the discharge process would be phenomenal, really. And I hopefully see it improving, really, because this sounds like an easy sort of step.
Yeah, thank you. Yes, I think it is. It would be a very simple step. Yeah.
So, which is great, and it integrates into their normal systems, does it, or how does it work from a hospital perspective?
Well, ultimately, yes, we can make it bespoke, so it integrates into their system. But at the moment, you can literally just pick it up and just use it. Yeah, it's just there. It's like you'd Google something. I mean, it's just there, and you can just fill in the form, and it would just come back to you, and GDPR protected, etc.
Wow, that's really great, Debbie. Thank you ever so much for chatting around hospital discharge and how potentially they can expedite that. It's been really interesting to hear about the technology that you have. So thank you very much.
My pleasure. Lovely to speak to you, Natasha.
Take care. Bye-bye.
Bye.